All right. Good morning.
Good morning.
And you are?
Jennifer.
Hey, where are you from?
California.
Welcome. And your surgery was?
April 4th of 07. So
Right.
16 months ago.
16 months, and you lost?
145 pounds. I'm a size 2.
Whoa! Congratulations. Very good. Oh, really?
Yeah.
Oh, good.
I thought you looked familiar.
I'm trying to remember.
Is that right? Can you remember what she looked like?
What I look like?
No, what
Or
she looked like.
I can't even remember what I look like.
This room seemed a lot bigger that week. Now it's less intimidating.
Good.
It's kind of scary that week, but
So you're a little nervous before the surgery?
I was terrified. I had never been in the hospital for a broken bone, anything, so I was scared of the IV, I was scared of everything, but the only thing that I didn't like was the IV. Didn't have any other pain.
They're not cool.
The IV,
Was it
oftentimes we hear that the IV is the worst part of it, and we say to that, yes.
And the
Because-
packet.
In the packet.
The packet is pretty
I'll
brutal.
cut that part. But if you can take major abdominal surgery and make the worst part the IV, you know, we're kind of,
Yes.
we're proud of that. Well, how did your surgery go then? It went all right?
It went great. 28 minutes. I was walking around about 3 hours later. My dad was telling me to slow down. My Dr. Ehrlich said it's good to walk.
Right.
Didn't really sleep a whole lot that night, but I went home, went to the hotel the next day and just slept a lot. And then the next day I was at Planet Hollywood and I won $60. So I was feeling really good right after.
Good, good. And how's your year been then since then?
A whirlwind. I can't
Is your
believe
life-
it's only been a year.
Has
Yeah.
your life been different?
I shop a lot more. It's very dangerous. I'm a teacher, and so I teach kindergarten. So I had parents at the end of the year graduation did not believe it was me. They were upset that they had changed their child's teacher. And told them. So I just show them in the program that it was my name, and I was the same teacher that started the year with their child. But it's been good.
We had a story like that where one of our patients was the wife of a minister. And one of the things that ministers do sometimes is go to other churches, and as they're preparing for the service, you know, depending on what kind of church you're in, generally you're quiet because you're, you know, meditating and preparing for the service and things like that. But you'll kind of look around and you'll see people that you know, and you do this. So the minister was doing this. He saw people he knew. He's like this, you know, and how are you, and things like that. And people were going and looking away. And he couldn't figure out. And apparently everybody thought he was there with some other woman because his wife had lost all this weight. So.
My dad is actually a pastor, and I have been at church, and he has not recognized him. He's come walking up and like, oh, I didn't know that was you. So I've experienced that too.
That's great.
I do have a question. I've
Yeah.
had a couple of times that my legs have been swollen, and I asked my primary doctor about it.
Right.
She said, lay off the salt. So I wanted
Yes
to
and
ask.
no. That's a good question. If you have swelling a year afterwards, you want to beware that you could lose too much weight and become malnourished. And so you're very thin, and you said size.
Could you say that again?
You're very thin. Everybody together.
It
You're
never
very
gets
thin.
old. It never gets old.
You look lovely. Everybody, you look lovely. Yeah. But you have the risk that we bypass too much, you could lose too much. So that takes us back to what we were talking about just a minute ago. Are you taking the creatine?
I just started.
Okay, so that's a good thing. That'll help build that muscle and the protein. And the whey protein and the glutamine?
I haven't been doing that.
That's okay.
I'm going
But
to start.
yes, okay. But that's okay. It's not negative. But what can happen, again, is the surgery is tremendously powerful. It's not perfect. And so we have one of your litter mates here, right, who didn't lose enough, only lost 80. You have the risk that when we guessed how much to bypass for you, that we bypass too much.
Right.
And so to protect against that, you have to really push harder to be more cautious about eating frequently during the day. So like when you're a teacher, again, you know, Heidi said that she had in the pockets of her work clothes food. So you want to get like a Power Bar or a Cliff Bar or things like that. And so all during the day, almost every 10, 15 minutes or half hour to nibble on something. You don't want to try and get a whole meal in, but you want things to have as food because that's going to help build up your protein. Now the way it works is you hit a low after the surgery around 1 to 2 years, and then you bounce back up so that you have a good chance.
Part I'm afraid of.
Well, that's right. But on the other hand, with the swelling and your size 2, you have that risk of getting a little too low. And again, the nice thing about the extra protein is that it tends to build muscle. And so what we want you to do is keep that, healthy, thin body, but avoid getting too thin.
Right.
And so the supplements are a good idea.
Okay.
And pay attention to those and stay in touch with us about that. But now you have the luxury of kind of eating as frequently as you want and as much as you want.
Almost doctor ordered.
Yeah.
Who would have thought?
Yeah.
I have one other question. For my blood work, they always want me to fast for 12 hours.
Yes.
And that's really...
It's hard.
Should I fast for 12 hours, or would 8 be okay? Or
it's a good question. We have had some of our patients go to have a medical test, and they said, you're going to have a stress test tomorrow. This is one of our 65-year-old women who actually has become a movie star. She is in the TV ad for Aleve. But, of course, she doesn't take Aleve, so she's fibbing. She's in this ad where she says, Aleve is wonderful. It lets me garden and everything like this. But she's an actress, so that's okay. But anyways, so she had to have a test, and they said, we're going to do a stress test, cardiac stress test. So don't eat anything after midnight. Well, the next morning, the stress test treadmill was broken. They said, don't worry, we'll have it ready, So it wasn't until 3 o'clock that afternoon, and she started to walk on the treadmill, and she couldn't talk. She lost her ability to think and talk and got dizzy, and they told her, you have a stroke. So she called me, and I said, no, you're just low on salt. So you do have to shorten that up and get permission from your doctor, but yeah, I think 8 hours would be fine.
okay.
And also the other thing is, in the run-up to midnight, you can kind of eat like crazy and have a lot to drink to kind of really build up and have some extra salt and things like that in preparation for the next day.
Okay. That's it.
Have you had any of your blood tests done yet?
They did not tell me that they wanted me to fast. My 1-month ones, they didn't want me to fast.
Okay.
So they kind of put them on.
But do your tests look kind of
next
okay?
week. So far, yeah.
Okay.
But I just want to say, last week I saw my doctor. It was the first time I had seen her since my 1-month post-op, and I got to watch her remove obesity from my list of problems, hypertension, and pre-diabetic. So there's really the weight loss is great, and that makes life a whole lot more fun, but she even was saying how rewarding it is as a physician to be able to do that. So it's just there's so much more than just the weight loss that makes it so worth it.
Wonderful. Congratulations.